So welcome to the February Concussion Resource Center Education Series. This week, our featured speaker is Crystal with Bowenwork, and she'll be sharing with us how Bowenwork renews the body's capacity for self-healing. And it is a delight to have you here today, Crystal. Your background, I don't know a lot about it, but from what I do know is that you're a licensed massage therapist, certified Bowenwork practitioner, and a master herbalist. So it sounds like you have a lot of tools in your toolbox. And I really look forward to hearing what you have to share with us today. So thank you for being here.
Well, thank you, Terry. Yes, I am a Bowenwork practitioner for about 4 years and a massage therapist for 21 years. And then I've also been a master herbalist for forever, so a long time. But I am really excited about being a Bowenwork practitioner because of the results that I'm seeing. So that's why I was asked to go ahead and give this presentation on Bowenwork and how it can renew the body's ability to self-heal. So
you have to, you muted. You need to unmute.
okay, just want to make sure I knew how to do this here. Okay, so being able to renew the body's ability to self-heal. See if this will go. Trying to figure out why. There we go. So it resets the body's autonomic nervous system and enhances the body's physiological responses, and it gives the body the tools to spontaneously heal. So Bowenwork is a very gentle form of healing. In order to appreciate its subtlety, it really needs to be experienced. Sometimes it is called the homeopathy of bodywork. Bowenwork is a system of moves along the muscle and connective tissue that enhances the body's innate ability to heal, creating balance and resetting the nervous system out of the fight or flight mode. So after the first session, people often wonder how such gentle moves can have so powerful of an effect, not only on their posture and structural problems like their bad back or frozen shoulder, but also on their general well-being. It's different from a massage in that while the hands of the therapist is in contact with the client the whole time, the practitioner performing Bowenwork will apply a few moves and then let the body receive and process for a couple of minutes or longer, depending on the procedure being applied. The level of touch used in a Bowenwork session is very gentle and will vary according to the sensitivity of each client. The therapist uses her fingers or thumbs to move over muscles, ligaments, tendons, fascia, and joints, and occasionally over the nerves themselves, in order to elicit a healing response in the body. With certain procedures, the practitioner can target specific issues or deal with the body as a whole. Healing happens by impacting the body's autonomic nervous system, which creates homeostasis at the cellular level. Absolutely nothing is enforced without. The sole intention of the work is to encourage the body to react by thoroughly boosting its own natural ability to self-heal. So it can assist recovery from many conditions: traumatic injuries, concussions, overuse injuries, high-low blood pressure, stress reactions, arthritic pain, fatigue, fluid retention, ear, nose, throat problems, TMJ problems, depression, ADD, ADHD, Parkinson's, to name just a few. Babies to grandparents, athletes to those recovering from surgery, or illness, and everyone in between can benefit from Bowenwork. Bowenwork was developed in the 1950s by the late Tom Bowen of Geelong, Australia. Bowen's approach was to reset the tension in certain muscles and muscle groups by using a unique type of stretch and roll through move, and then pausing between the sets of moves to give the body time to respond. And he achieved amazing results. According to a 1974 survey of alternative health practitioners performed by the Victorian government, Bowen was found to be doing over 13,000 treatments in a year. That's in a year. And what was really amazing is that he was able to get 85% success rate with problems for which his patients sought for treatment, and they were able to be resolved completely. So 85%, that's a pretty big percentage for any type of treatment that's going on. In the last years of Bowen's life, he allowed several practitioners to observe him, and he recognized only 6 of these people as understanding the work. One of these, Oswald Wrench, promised at Bowen's deathbed to make his work known around the world. Ozzy's interpretation of Mr. Bowen's work is now taught in over 25 countries under the name of Bowen Therapy Academy of Australia, and is known under the internationally registered trademarks of Bowtech and Bowenwork. So I was living in Oregon, south of Salem, when I first heard of Bowenwork. A former massage therapist came to me for a massage, and during our conversation, she told me about how Bowenwork relieved her migraine headaches. I was looking for continuing education at that time, and when I heard of Bowenwork, it clicked. I knew that was it. I soon found a class, and in 6 months' time, I was a Bowenwork practitioner. Then soon after that, I moved to Helena in August of 2017. My husband and I did that. And since then, it had taken me time to actually establish clients, being in a new area. And I found that I was losing some of my newfound abilities and new training that I had just received. So I had asked one of the instructors, her name is Karen Tuhig from California, to come in and teach classes to other students. And that way I could get, have a way to be able to relearn some of the things that I had already learned. Karen, she has 20 years or better of experience instructing, and she loves to teach. So I met her in 2017 when I was training to become a Bowenwork practitioner, and then I took a little more training from her before I moved to Helena. It is so exciting to see amazing results with 1 or 2 sessions. As a massage therapist, I only saw great results a few times. One, which was when I was able to work on my husband with a frozen shoulder, which took a lot of work. Bowenwork is much easier on me and my body. With regular massage, my clients would often tell me the massage was the best they ever had. But this is different. After moving to Montana, I realized just how much Bowenwork excited me. I have learned from the best instructors who have transferred their passion for Bowenwork to me. So here's some of the testimonials of a few of my clients. A couple of them are my neighbors. One is from just next door. My neighbor's 3-year-old little girl fell from a ladder like 10 feet on her head on a hardwood floor, and she'd fractured her skull. Within just 2 sessions of her just sitting in my lap, that I was able to perform the Bowenwork, and within the 2 sessions, the doctors were really pleased on how quickly she had healed. And now she runs around, you never know anything would happen. Another neighbor was able to get the swelling down in her arthritic knee and get full range of motion from a 2-year frozen shoulder issue within 4 sessions. Physical therapy wasn't even able to help her. Other clients are excited that the treatments last. Once the issue is resolved, it seems to stay gone. I also love being able to work on more than one client, which I can do with Bowenwork. I had a couple come in. The wife wasn't going to have anything done because she wanted to have her husband get some help with the 20-year unresolved sciatic injury. I urged her to get worked on too. She now can go walking without her hip locking up. And her husband, a 93-year-old World War II vet, can now walk easier and is almost pain-free. They traveled over 3 hours from Laurel to come for treatments. And when the session was over, he would always ask, "When do I get to come back?" Another nearby client came to me with back issues. She wanted a massage, but after explaining what Bowenwork could do, she gave it a try. She was my most skeptical. So I even gave her the guarantee of a regular massage if Bowenwork didn't give her the results that she wanted. Well, after 3 sessions, she was convinced. It not only helped her with her low back, but she saw results in other areas of her body that she wasn't expecting. I went to Bozeman to do massage and iris analysis because I'm an iridologist. It's another thing I do. I gave those that wanted a massage the option to try Bowenwork. One of those people that said yes has seen exciting results. She had tried several different ways to relieve the pain in her legs with little to no effect. She texted me the next day this message: "I am feeling so much better. I went to bed at 8 p.m. and woke up at 7. I had sound sleep and very little pain. I am walking much better. I'm so excited." So now I have regular clients come to me in Bozeman to receive Bowenwork every other Wednesday. Another lady, a nurse, came to me just to try it out. She works long hours on her feet and is walking a lot. Her knees were giving her problems to where she had a hard time going up and down stairs. After the first session, she could go up the stairs with very little discomfort. The last time she was here, she was so excited because she went up the stairs without even thinking about it. Her shoulder has felt better too. Cheryl Kasdorf, a naturopathic doctor who uses Bowenwork, relates this experience. A 17-year-old female had spasms up and down her back every 30 seconds, which were painful and exhausting. After a visit to the ER and a spinal tap to check for meningitis, they gave her pain meds and muscle relaxers and sent her home. Nothing changed. The next day, during her first move of the Bowenwork session, everything relaxed. She felt pops as if it seemed that bones moved back into place. After the session, she was relaxed but sore for the next day, but the spasms did not come back. Bowenwork practitioners see results like this over and over. In addition to reduction of pain, increased mobility, and a general sense of well-being, it is common for patients to sleep more soundly and then have increased energy levels. When this happens, muscle tension decreases, nerve hypersensitivity is reduced, and the feedback loops that control acute pain in the body are interrupted. At the same time, the parasympathetic system is naturally restored, increasing blood and lymph flow, feeding deprived tissue, and reducing inflammation. While there is often immediate reduction of pain and spasm, results are just as likely to unfold over a longer period of a few days to a week. Bowenwork can relieve and restore within 3 to 4 sessions for simple things, or just for most conditions, but for more chronic issues, they may need between 3 and 8 sessions. There is also a specific set of exercises that Tom Bowen came up with to help continue the releases once the patient leaves the office. So let's dive deeper into why Bowenwork is so effective. One of the main reasons is that it enhances the body's physiological responses. So learning about some of the physiological laws enhance our understanding of how the body responds to Bowenwork. And I'll talk about 5 of these laws. The first one is the Arndt-Schultz law. Weak stimuli increases physiological activity, while very strong stimuli inhibit or abolish physiological movement. Bowenwork uses gentle, slow moves, which are discerned by the body as weak stimulus. Activating healing. We are making the touch to the body gentle enough so as not to instigate a defensive response. In contrast, deeper work such as trigger point and deep tissue massage can give off strong impulses that can turn off other processes in the body. So this gives you a better understanding of why the slow, gentle Bowenwork technique is so effective. Hilton's law. A nerve trunk that supplies a joint also supplies the muscles of the joint and the skin over the attachments of such muscles. Bowenwork moves work superficially on the body with a small amount of pressure. By stimulating the surface of the skin or structure, all of the structures supplied by that nerve trunk are affected, releasing deeper tissues, muscles, and joints. In an injury, it may be difficult to determine if the pain is coming from the skin, muscle, or joint. Pain from any tissue can affect the other tissues. Treatment by stimulation of any and all tissues affects all other tissues. That's why light pressure movements over the skin or gentle, slow moves stretching a muscle can affect the joint. Reciprocal inhibition. When the agonist is firing and the affected joint moves, the antagonist group will be inhibited. This is the basis for coordinated movements of the musculoskeletal system. The classic Bowenwork move will very gently stretch the muscle sideways and then very gently let it go. This stimulates proprioceptors such as spindle cells and Golgi tendon bodies by way of spinal reflexes and the central nervous system, resulting in changes in the resting length of muscle fibers. So it doesn't just relax the muscle, it will reset the tension in not only the muscle we are releasing, but also will cause an excitation response in its opposing muscle. Tight muscles are loosened and opposing loose muscles are tightened up. It is a true rebalancing of muscle tension. The all or none law. If a stimulus in any strength above threshold, the nerve or muscle fiber will either give a complete response or no response at all. Therefore, the strength by which a nerve or muscle fiber responds to a stimulus is not dependent on the strength of the stimulus. Tom Bowen always said less is best. By using only enough stimulation with the Bowenwork move to take the nerve or muscle fiber to just above its threshold, the response is initiated, and that is all that is necessary. This means there is no need to continue to work in an area, eliminating additional irritation or inflammation. The law of conservation of energy. Energy is constant. It is neither created nor destroyed, but only transformed from one form to another. When a traumatic event, such as an accident, occurs, the energy of the force of the accident is absorbed by the body. This energy must be released from the body or be transformed for healing to occur. After a set of Bowenwork moves, the patient is left to process at least 2 minutes before the next set of moves are done. During this time, energy can dissipate freely or be transformed. So now we're going to delve a little bit deeper in this law of conservation and energy and how it relates to stress and anxiety. When an individual is hurt physically or emotionally, there is an energy force that enters the body. If the body is not able to dissipate the power of the physical injury or the psychological impact, it remains in the tissue. In an initiative to decrease the disturbance to the body from this foreign power, the energy forces walled off. This develops an energy cyst, a term coined by Dr. Elmer Green. The location of the chaos does not blend well with the body's energy system, and the energy cyst needs an energy input to be preserved. In other words, in Chinese medicine, this energy can also be called life energy or qi, but it must move freely throughout the body to assure a state of optimum wellness. We can likewise call this stress and anxiety the emotional, physical, and psychological variables that create injury, discomfort, a sense of loss of or danger, lead to numerous chemical reactions in the body, especially the nervous system, the brain, and the hormones. Adrenaline is released from the adrenal glands, which increases the heart rate, the blood pressure, breathing rate, as well as the blood sugar, all designed to get oxygenated blood to the muscular tissues to either fight the offending circumstance or take flight to get away from the circumstance. So this is referred to the sympathetic nerve system response. As soon as the danger is gone, the calming result of the parasympathetic response balances the body again. Now, persistent tension causes abnormal levels of hormones being sent into the bloodstream for extended periods, primarily cortisol for the adrenal glands, which can detrimentally influence brain function, especially memory and sleep. High degrees of cortisol also affect two fundamental parts of the brain that regulate all various other hormones in the body, the hippocampus and the hypothalamus, which influences the master gland, the pituitary gland. Then the pituitary gland influences the thyroid gland, and then also the adrenal gland, the kidneys, and sex-related glands and all other regulating systems that control healthy and balanced metabolic rate. The chronic stress and anxiety and the energetic disruptions of the energy cyst can result in compensations that inhibit normal body functions and can cause severe or chronic discomfort by influencing the structure. The Bowenwork professional's accurate, methodical, and willful application of gentle pressure has the structural as well as psychological effects through the release of both stored memories and toxic compounds, which then breaks up the energy cyst. Connective tissues have a crystalline nature due to the way the collagen molecules have arranged themselves. Collagen crystals are piezoelectric, which is a Greek word implying pressure electricity. And therefore, stretching of the body fabric will create small electrical charges which have strong healing properties. Dan Amato, an instructor for the Bowen Therapy Academy of Australia, has pointed out that it has been shown that mild crosswise stretching used in Bowenwork produces a stronger piezoelectric current than just pressing on the muscle. Tom Myers, author of Anatomy Trains, and various other fascial experts speak quite a bit concerning the piezoelectric effect of fascia work. So how does all this relate to those that have had concussions? Well, we know that every year there are thousands of PCS and TBI cases that occur nationally from numerous injuries. This prevalent injury is such a medical enigma that it carries a range of definitions, the majority of which to point to interruption of proper brain function, and then when the body's natural intelligence as well as natural auto-regulating capacities are seriously disrupted or create dysfunction by the uncontrollable impact of head trauma, the combined insult is slow, lingering healing. That slow recovery may become the body's encoded version and also be a reference for any subsequent comparable injury, implying that one sluggish healing may create another. Although there's a lot of PCS cases that recruit spontaneously, many do not. And there is no medical agreement relating to the needed time for a complete recuperation, or perhaps what comprises a full recovery. Post-concussion disorder can have up to 36 possible symptoms. The worst are the loss of consciousness as well as post-traumatic anemia. Nevertheless, when a person can be seen when the symptoms first happen, the efficient healing option is offered to the body's natural self-correcting abilities, which initiate a swift recuperating response. Regardless of the massive research through and thorough efforts of specialists to handle PCS and MTBIs, there is still no specific remedy for this puzzling problem. Well, until Bowenwork practitioners started seeing and recording results when applying certain procedures of Bowenwork in a specific order with longer delay times. It has been recorded that people who have had multiple concussions have responded well, just as favorable as those that have had just one concussion when receiving Bowenwork. So one unintentional case was from Craig Matimo. He recorded 33 cases of sports-induced PCS situations over 9 years. And if you want these, this is where I got the information. So if you would like to get, you can go on to the American Academy of Bowenwork and you can look at these 2 case studies yourself too, as well. So his situation is that 1 week after becoming a Bowenwork practitioner, his brother, who was a college football player, came to him with a pulled groin. After successfully treating the issue, he was asked to apply his newfound modality to his brother's teammates. And this happened for the next 10 years. In mid-season of the second year, 3 teammates all experienced impact-related concussions, all in the same game. After skillfully applying certain Bowenwork procedures right there on the playing field, he was able to try that again. There we go.
You left us in
Okay, there we
suspense.
I could tell. Okay, so after successfully treating the issue, he's asked to continue to apply his newfound modality to his brother's teammates for the next 10 years. In the mid-season of the second year, 3 teammates all experienced an impact-related concussion the very same game. After skillfully applying certain Bowenwork procedures right there on the playing field, he was able to balance out the trauma-induced neurological overload, initiating the body's capacity to rebalance the asymptomatic recoveries of all 3 teammates safely and swiftly, as well as 30 more cases over 9 consecutive years. Bowenwork reliably demonstrated the ready capability to resolve this nonstop, reoccurring, poorly misunderstood phenomenon. 19 of the players were asymptomatic within 24 hours. 24 were symptom-free within 2 days. What is amazing is that 26 of the 33 athletes were independently, clinically confirmed as recovered by team trainers or medical professionals and given official sports medicine clearance to return to play within 72 hours. Post-session. The symptoms did not return. So 2 of the teammates, there were 3 that were slower to heal, but they still recovered in what they considered a favorable period. 2 of the teammates took 6 days to recover, and 1 took 12 days to finally heal. All 33 recouped, as well as obtained clearance from their physicians or trainers to return to play. What is even more remarkable is that there is no tissue damage and they spontaneously recovered in their own time. Now, some of the experiences, let me go back here. Oops, go back. So there's been a couple of, I've seen 4 people that have had some sort of head trauma. So the first one we talked about was the 3-year-old that we talked about earlier. The second one was of a gal who fell at work and was diagnosed with concussion. And then she had her knee that was having some issues. After the second treatment, she emailed me this. She said she was sore, especially in the neck, and her head and knee were doing better. She said she still had headaches, but not as sharp, and the ringing in her ears had decreased significantly. And her knee was doing great. So she mentioned that twice. Another gal who has had both TBI and concussion on 2 different occasions reported this the day after her first session. After leaving, my body felt so relaxed and the intense fight-flight was gone. I haven't felt that relaxed in I don't know how many years. My pain is so much better and I slept better than I have in a very long time. Today, I still feel that calm in my body and like I'm wrapped in a warm blanket. My core and spine feel warm and supported. My back pain is significantly less. I feel like I can emotionally regulate my life stressors that have been causing intense anxiety better. I have been completely amazed at this transformation. I think this is going to help my body release emotional trauma responses also as I have these feelings of peace coming over me and like I don't have to be on alert for attack. My body feels better. Then a few weeks ago, I had a business owner in his 60s from Billings come in the day after he fell out of the back of his truck on his head. Because of weather, I've only seen him once, but I have kept in touch with him. And when I asked him how he was feeling, he said, much better. And he never lost any work. So the Bowenwork method embodies a holistic approach to health care. It is a concern not just with addressing certain signs and symptoms, but also implying an all-natural possibility to express itself in every aspect of the individual's life. It has effectively demonstrated that it initiates the rebalancing and corrective capabilities, utilizing delicately and also dependently, setting in motion the body to accelerate its all-natural capacity to self-correct, as well as renew the body's ability to self-heal. So now people will ask, well, what happens in a session? So typically we just need 3 to 5 sessions, 1 week apart. In this case, when I go to Bozeman, it's usually 2 weeks apart, but it still is effective. And that is all that's required for most situations brought about through overuse or sports or other injuries. More complex conditions will usually require additional sessions. So you would wear or bring lightweight, loose fitting clothing, and that I can work through, or you may choose to wear your underclothes and be professionally draped for modesty and comfort. I will take a health history and ask about the reason for your visit to select the best Bowenwork moves to apply that day. I usually apply the basic relaxation moves in the first session to balance and prepare the body for more specific moves for the next session. With concussion clients, I always apply the specific procedures with longer wait times on the first session. The actual hands-on work may take very few of the 20 to 60 minutes of the entire session. After each series of moves, I will make sure you're comfortable, and then I'll leave the room to allow your body time to begin responding. So what to expect afterwards? Some changes may be noticeable right away: reduced pain, greater range of motion, a sense of relaxation and well-being. You will most likely notice the changes in the next several days as your body continues to process that began during your session. Sounder sleep and increased energy are often reported. If your practitioner assigns homework, or if I assign homework of gentle Bowenwork exercises, you do them the day after your session. This is an important part of your care and will improve your results. And then I always tell my clients of the 3 W's: walk, water, and wait. And the wait means that there are no other modalities being applied for at least 5 days, like physical therapy, hot packs, cold packs, massage, or anything else that might interfere with the Bowenwork session. So I hope this gives you a better understanding of how Bowenwork can renew the body's ability to heal. I do have a small book. I was supposed to have it with me. It's about that size or so, but it's called Understanding the Bowen Technique by John Wilkes. And that it gives you a good understanding of Bowenwork and what to expect. And I have those available for $5 for anybody that would be interested in that. And I'm also in Bozeman every other week, and if on a Wednesday right now. So March 4th is the next day that I will be there. And if I need to take more than just Wednesday to see clients, I can always add another day, either the day before or the day after. So it's now open for questions or comments. And thank you for being here. So anybody have any questions or comments?
I want to thank you for a very thorough presentation that definitely gave a really great overview, and then also more than that by going into all of that. So thank you.
You're welcome.
I don't have a specific question. I just wanted to thank you for the thorough presentation.
All right, thank you.
I have a question.
Yes.
I'm sorry I missed the first part, so maybe I missed this, but how does this compare, or can you compare to craniosacral work? Is it similar, totally different? Is there any connection with those? I was just curious.
It is a different modality. So Bowenwork is using the thumbs and the fingers, usually somewhat like this, and we're going over muscle fibers. For example, one of the moves would be placed right on the other side of the spine, right on that muscle fiber, and then I do a pull, drop, and I roll through the muscle, which is different than a cranial. You have all different, I've done cranial, but it works along the muscle fibers, the tendons, and joints, sometimes over the nerves, but it is a lot different than the cranial. So it works. I tell people if they have an issue, there's probably a Bowenwork procedure for that. So they just have lots of different procedures. So for example, for the concussion, there's a certain set of procedures that I would apply, and they have found that when I have longer wait times, because usually I'll do a series of moves and then I leave their space or their room for 2 minutes for their body to respond. And then I come back in and I do a couple of more moves and I leave the room, let the body respond. And that's the process of how the Bowenwork will continue on throughout the session.
Thank you.
Yeah, you're welcome. Does Jan, my friend Jan, do you have any comments or anything that you would like to relate? She's actually one of my clients.
Yes. Can people do any moves on themselves? Is there self-bone work to do?
That is a very good question. I am currently what they consider an associate instructor. And by being an associate instructor, I can teach a 4-hour class, Intro to Bowenwork, which would teach certain Bowenwork moves that most of them you can do on yourself. And so things to, for example, if you have an emergency knee issue, there's a couple of moves you can do on your knee. There's a move on the neck that you can do on the lower back. The mid back is kind of hard to do, but I do teach you that move so you can work on friends and family. And it is a great way to help, even just with the moves that you learn, to help treat shock, slow bleeding, and other emergency moves. So, and that's a 4-hour class.
Are you going to be giving that sometime in the next year?
Setting one up for Helena in the next, I would say in the next 4 weeks.
Oh, okay. Let me know.
Okay, I will.
Thank you.
Yep. Okay, is there any other questions or comments?
Just want to thank you, Crystal, for your presentation and the preparation of everything, and very nice presentation, nice explanation. Thank you very much.
Yeah, thanks, Crystal.